if ever there was a group to share it with, this is the one.
Totally.
Okay.
We'll be live in about 6 seconds. Great. Happy World IBD Day to everyone watching. My name is Rebecca Kaplan, and I'm an Associate Director of Marketing and Communication at the Crohn's and Colitis Foundation. More than 10 million people around the world are affected by Crohn's disease or ulcerative colitis, and countless others, including friends and family members, are touched by these diseases. If you have IBD or have a loved one with the disease, you know that these diseases are very individual. Everyone experiences them differently. No one day looks the same in the life of a member of the IBD community, and these experiences are even more different based on where you live around the world. So I'm excited for us to be hosting this special World IBD Day chat to share global perspectives about what it's like to live with or treat IBD around the world. I'm now excited to turn it over to Tessa Miller, who's going to moderate today's conversation. Tessa is a Crohn's disease patient living in New York. She's a health and science writer and an editor, and recently published her debut book, What Doesn't Kill You, about her experience with Crohn's. Tessa, I'm going to turn it over to you now.
Thanks, Rebecca. Hi, everyone. Thank you so much for joining us. We have such a great group of people here today, and we're here from all different places in all different time zones. So I especially want to thank you guys for staying up late, getting up early, being up in the middle of the night. It just is really special to see all of your faces on a day like today. I just want to thank Rebecca for asking me to moderate this chat. We have been email and social media friends for a very long time, but this is sort of our first face-to-face interaction. Hopefully we'll see each other in real life when things are a little bit safer, but I'm really excited to connect officially with Crohn's and Colitis Foundation. And just happy to have everybody here today. Happy if that's the right word, World IBD Day, everybody. I'm gonna introduce everybody who's on the panel now, and then we'll get started with the chat. I also just want to make a little disclaimer here that although we do have a physician on the panel, the rest of us are not health professionals. So before you take any advice, make sure you talk to your doctor. Just have to put that out there. Okay, so let's introduce everybody. First up, I'm going to go in ABC order. First, we have Rasheed Clarke. Give everybody a little wave so they know who you are. Rasheed is an ulcerative colitis patient living with a J pouch from Ontario, Canada. Next, we have Dr. Sara El Ouali. Give a little wave, Sarah, who is really coming to us from the middle of the night. She's a gastroenterologist at Cleveland Clinic Abu Dhabi and an IBD specialist. Jacinta Parsons, give us a wave. There she is. She's a Crohn's patient from Australia. She's coming to us from the future, I think.
The future's wonderful.
Yeah. And she hosts afternoons on ABC Radio Melbourne and is the author of Unseen about her journey with chronic illness. And last but definitely not least, coming to us from the UK, where it's almost midnight, I think, 11 p.m. We have Nordia Willis. She is an ulcerative colitis patient from the UK. All right, so let's get started. I first want to ask everybody just so that we can get like a little timeline in place when everyone was diagnosed, if you have sort of a year, and with what form of IBD you were diagnosed with. I was first diagnosed with ulcerative colitis in 2012, and then that changed to indeterminate IBD in 2013, and then my Crohn's disease diagnosis was confirmed in 2015. So let's start let's start in Australia with Jacinta. Jacinta, when were you diagnosed and what form of IBD do you have?
While I'm in the future, I go well back to the past, and it was in the 90s, back in about 1998, that I was diagnosed after a long period of illness that I couldn't work out what was going wrong. And I was diagnosed with Crohn's disease.
Okay. Rasheed, you want to go next?
Certainly. So my first symptoms showed up in 2007, and those symptoms were diarrhea, urgency, bleeding during all of the bathroom trips. And I didn't actually get a proper diagnosis until about a year and a half later in 2008, and that was with ulcerative colitis. And then after a few years of things being in relatively good condition, the disease worsened to the point where I had to have the colon removed. So I went for surgery in 2013 and had the colon removed. Lived with an ostomy for about 9 months, and then 2014 got the J pouch or pelvic pouch up and running, and been living with that ever since.
Great. Thanks for sharing that with us. Nordia, you want to go next?
So I was roughly diagnosed at age 17. So I think that was about 2004. And so months before that, I had the usual, the bloody diarrhea and the cramping. And then in like 6 years later, in 2010, I had to have a subtotal colectomy. So that's just the complete removal of the large intestine. And with my UC, it was a roller coaster ride because I've got another genetic condition as well. So they're trying to treat both of them at the same time. So certain stuff that I could be prescribed for my UC, I couldn't take because of this other condition. So I then had a ileostomy in 2010 for about 8 months. Then I had it reversed. And then quite recently now, I had to have an emergency operation because my UC flared up again. And I am now back with my ileostomy. So I've had it for about 6 weeks now.
Okay. Does it have a name?
It does, actually. And you know what it was? Like they talk about it and then I'm thinking, why did I name it? And then I named mine suddenly out of the blue. It's called Sally. Don't know why.
Sally. We love you, Sally. All right. Thank you guys so much for kicking that off. And so we can all kind of get an idea of when we were all diagnosed. Dr. El Ouali, Sara, I still feel weird calling you Sara, but I'll try my best.
Please do.
So you're an IBD specialist with Cleveland Clinic, and I was just wondering sort of what your path was to get to being a gastroenterologist and also really focusing on IBD.
Right. So I really loved gastroenterology during my residency because, it could allow you to see patients in clinic, but also do endoscopy and do sort of more interventional things. And I thought it would be a really interesting hybrid, way of doing things. But I actually loved liver patients. I love taking care of liver as an internal medicine resident. And I actually really went into GI because of that. And then during my fellowship in gastro, I got to meet so many patients with Crohn's disease and colitis. And it was actually only my second year of fellowship that I realized this is exactly what I want to be doing. And the reason I went into IBD is because, and I think you can see it from just talking to these wonderful people, is it really affects you so much, right? And so as a doctor, there's so much you can do. And you can truly impact these patients' lives, They literally come in, with very poor quality of life and their life is all over the place, and you really can do something to make them better. So I thought that was extremely rewarding. So it's not easy, but it's very rewarding. So I'm very happy to be doing this.
Well, we're happy that you're doing it too, because we need good providers. You kind of touched on another question that I want to get at, and that is the overlaps of physical health and mental health when it comes to IBD. There's just such a need for mental health care for people who have lifelong illnesses. And I think a lot of us sometimes are, we're taken aback by how heavy the mental and emotional burden of our diseases are. So I guess I just want to ask everyone, but I'll start with Sara. When you see an IBD patient who's struggling not only with the physical symptoms of the illness, but also the mental toll, what's some of the advice that you give, some of the resources that you connect them with, that kind of thing?
Right, I think it's a great question, and I have to say it's always a little bit uncomfortable to start talking about this because you just, you go into these patients' lives and you really want to make them better, and you're just so afraid that you're not going to be able to address everything properly. I have to say I've lived in different countries and taken care of patients from different parts of the world. Especially here, we have patients really from all over the world and who don't necessarily have the same access to medical care.
Mm-hmm.
I'm privileged to be working in the Cleveland Clinic, but right, next door, it may not be the same thing at all. And I've noticed that, so the first big issue with mental health here in different communities is the social stigma associated with IBD. And so not only do they have to live with their symptoms and what IBD is doing to their bodies, but there's also a lot of pressure socially.
Mm-hmm.
And it's really hard to address, I have to say. So we do have, resources with mental health providers, but sometimes, unfortunately, and I've had this problem with so many patients, is that not all of them have access to them. And so it's a lot of work, and what I try to do is I try to at least try to communicate very well with them, make sure that, they understand, I understand what they're going through. Um, and then, try to refer to mental health providers here and there, and then to online resources. I think that's extremely helpful. But I'd love to hear from the others, how they've been coping with this.
Yeah, let's open up the floor, and just maybe you could talk, maybe let's start with Rasheed. You can talk about sort of your, some personal stuff about the mental burden of our illness, and also sort of what mental health resources are available to you where you are in Canada.
So one of the things that Canadians like to tout is our universal healthcare, and it is wonderful, but it is universal like to a point, where at some point you do have to, or in many cases, patients will have to pay out of pocket or get a private insurance plan to cover mental health coverage. So that's where there is a gap and kind of a patchwork of health resources for mental health across the country. And it varies wildly depending on where in the country you are. And there can be a divide between urban and rural communities. So for me, I was very lucky in that I, first of all, live in a large urban center, number one. And number two, the family doctor that I have works as part of a larger medical practice that has a number of different number of other healthcare providers that work within that practice. So I was able to get a referral to a counselor when I needed mental health support. And I was able to speak to that counselor once a month for an hour, nothing out of pocket. If I required potentially more treatment than that, or if I wanted to see someone more often, then I might have had to have looked elsewhere to a private service provider. I know that we're getting better with more online supports, trying to make things accessible by using technology. And I think the pandemic has really accelerated that need and accelerated the opportunities that are available for mental health providers. That said, there's still a cost to it for a lot of patients, and that can be prohibitive. And I do think that the stigma is certainly part of it, but I honestly feel like if the money was less of an issue for a lot of people, more people would just go out and seek that counseling. Having it available readily and easily would make, I think, a world of difference. And I feel like sometimes the financial barriers are not as discussed as the stigma. Both clearly exist, but sometimes I feel like the more we do to help people just access things for free, or at least a diminished cost, the more they'll access that treatment.
Yeah, absolutely. Thank you so much. Nordia, do you want to talk about what it's like in the UK for mental health resources, and maybe some of your own personal story?
I think here in the UK, we're quite fortunate because we have the good old NHS, National Health Service. So although we pay for it via the taxes and our national insurance, we don't feel so much out of pocket, because when we need the service, we can easily tap into it. And with the whole mental health situation, we have right now at the moment, we have a wide range of service that we can tap into. But I can personally say, in my personal experience in 2010, when I had my subtotal colectomy and I had to have my ileostomy for the first time, obviously that was also done on an emergency basis as well. So I was a bit like, oh my God, what is this? I went into depression, but I didn't access anything. I didn't, because I wasn't aware. I just thought I could just deal with it myself, sort of thing. Now the second time round, I know that there's, stuff out there that can help me. And obviously as time has gone on, it's gotten better. You now have more access to certain stuff that you didn't have before. So I definitely say I cope with it a lot better this time round I did than I did previously back in 2010, because I know that there's resources out there for me that I didn't know was out there in 2010.
Yeah, I think that's a common thread for so many of us, is that it takes often several years into our illnesses before we want to accept that the mental health part is part of this, and also to seek out the help that we need. Jacinta, I want to get to you too, and same question. If you want to share some of your personal story about sort of the physical and mental health connection, and also what sorts of resources are available for you there in Australia.
In Australia too, we sort of feel like we're lucky as we've got a Medicare system. Sounds very similar in a way, where it's helpful to a certain level, and you have access to really great medical care that is also we fund through our taxes. But like Rasheed, it is to a certain level. We get 10 psychological appointments a year that are funded that way. Also, we have IBD counselling services that are often attached to hospitals, so you can access them as well. But for me, getting diagnosed back in the 90s, it certainly wasn't something that was expected or supported in terms of the understanding of the toll of mental health. And I think it's really important to recognise how drastic chronic illness can be in terms of shifting a person's experience and life. You go from functioning in the world to possibly not working, your identity shifting as well. I also had an ileostomy bag for 4 years, and coming to terms with a physical shift and change in my body was a really, really hard one to have, but also just the physical pain. I think that is a really important part of understanding the psychological dimension of this, is that we aren't coping in the world as you would with an able body. And I think, I still think that we've got a long way to go to understand the absolute dimension of impact that chronic illness has on our mental health and well-being by its nature.
Yeah, absolutely. I want to ask you a follow-up, Jacinta, just really quickly too, just because you were diagnosed in the 90s, and that was sort of the early days of the internet. Now, when you're diagnosed with an illness like IBD, you can get online and connect with a lot of people who have the same illness. And that's really life-saving and life-changing for a lot of people who can just find a support group, on social media or through the internet. So what was your experience like then, when that wasn't so much of a factor? There weren't just groups of similar people waiting for you, with the click of a button.
It's a really great point because it was very isolating, and my expectation was that it's an isolating experience. I actually didn't, and still are coming to terms with how wonderful sharing experience is. So I did it largely by myself and have continued to do so because the behavior of joining groups wasn't part of the way I had illness. And so, look, I think it's such an incredible change, but it's a really important point to think about older people who have chronic illness, that behavior of access, even though they may have, internet, might not be there. And to encourage older connection, I think is really important as well.
Yeah. When I wrote my book, I sort of thought about it as a book for newly diagnosed people. But one of the most lovely surprises of the whole experience has been people in their 50s, 60s, 70s who were diagnosed with IBD many years ago, who have written to me and said, I wish that a book like this had existed then. And they are still not so much online, but they're going to the bookstore and looking for, hard copies of stuff about chronic illness. And so the points that you made there just ring so true to me. I want to, well, we've touched a bit on barriers in our different locations for mental health care. Here in the US, you guys probably know that it's pretty dismal. So if anybody wants to adopt me and bring me to any of your countries, I would happily come to any of them, please. But I do also want to talk about barriers you've faced in getting care for your physical illnesses as well. So Sara, let's start with you, just because you have a perspective as a physician who's worked in different parts of the world. You've been in the US, you're in Abu Dhabi now. I think you've also been in Canada treating patients. So you have a perspective of some different systems, healthcare systems. So can you just talk a bit about some of the obstacles that you've seen your IBD patients face in getting the care that they need?
Absolutely. And you're right, Tessa. It's interesting because having worked in different places, you can really tell there's always a struggle, there's always a problem with access, but it's always a different problem. So just last year when we were in the US, and again, I was very privileged to be at the Cleveland Clinic, but definitely, as a Canadian, to me, it was shocking how much people couldn't get, coverage for medications that were basically going to save their life or make them better. And again, as a Canadian, this was really, really tough to see. We're in the US, we're able to diagnose properly, we're able to treat you properly, but you can't get that medication because your coverage is not right, or because your insurance company is trying to do all these things to. So that I thought was ridiculous. And so, and I'm sure you know all about this, Tessa, but then a lot of the times that leads to delays in diagnoses or delays in follow-up colonoscopy because they can only get it at the end of the year, which to me was really crazy. So even though they get access to great care, it's really the insurance issues that were ridiculous. In Canada, it was amazing to hear Rasheed talk because that's exactly what we're experiencing. We have a wonderful healthcare system, but issue is access. And so once you're in the system, it's better, but you're going to wait months for your MRI, for your colonoscopy, and you may wait months for things that are urgent, but you do get great care. And it really depends as well where you are in Canada. And I think I really like that you pointed that out, Rasheed. Jacinta, you explained exactly what my patients are going through right now. You going through this in the 90s without anybody around you or no support is exactly what my patients go through here now. Because, so again, I'm seeing patients from all over here because we have a lot of expats. 80% of the population here is from all over the world and not local. And even my local patients, so the issue is all these patients are from different countries and don't necessarily speak English very well. There is just no resources for them online. And when there is, they're often not reliable. And so I think the number one issue I face here treating patients is there's very poor, awareness of IBD. nobody knows about IBD. Even doctors don't know about IBD. And so that leads to delays in diagnoses or, under treatment, over treatment. And that's the issue. Just nobody knows about IBD. And so that's been a little tougher for my patients here.
Yeah. Nordia, you said that you have the beloved NHS, which I'm very jealous of as an American. What kind of barriers have you faced there trying to get physical care, if any?
In all honesty, I can't say I've faced any. I'm able to call out an ambulance when I need to. I'm able to get my medication delivered to my home. In all honesty, I'm really, after listening to you guys, I'm really grateful for what we've got over here, because I hadn't have to face any barriers. I'm able to get an MRI, a scan if I need to, and sometimes too much, to be quite honest. At one point, I think I was being X-rayed every day, like for 7 days straight. I was being X-rayed until the department was like, no more, we can't X-ray anymore. And so it's been, accessing treatment. I've got I can pick up the phone and call my stoma nurse if something is, is not right. If I don't I can leave a message and she'll get back to me the following day or something like that.
Yeah.
They come to my home just to make sure that I'm taking care of my stoma and everything is going okay. And if I need additional medications and stuff like that. So it's been accessing treatment, and it's been fine. And because I've got another underlying condition, like accessing it quick enough, it's been okay as well, because they, obviously they don't want anything to go wrong by keeping me waiting and stuff like that. So it's been absolutely it's fine, to be quite honest.
What's the awareness of IBD like in the UK?
So I think when I was diagnosed in 2004, I'm not sure if it's based on me. I didn't see anything around IBD and stuff like that. In 2010, it was also probably perhaps the same thing for me. Perhaps it was just me not tapping into certain platforms and stuff like that. But now I just see everywhere. It's just, it's all over. And, they obviously, my doctors and my nurses also point me in the direction of certain products and stuff like that. So, yeah.
Yeah. Rasheed, do you want to talk a bit about any barriers that you faced for your care there in Canada?
Well, again, I've been very fortunate, and a lot of the care that I have received has been phenomenal, if not always the most timely.
Right.
I think that's maybe one of the challenges that Canadian patients face is, as Sarah had pointed out, sometimes there is a delay in, first of all, seeing an IBD specialist or just a GI. There can be delays in tests and colonoscopies. And the other barrier that I'll just touch on is related to prescription medication, where when someone may be prescribed a biologic, for example, that may cost a lot of money per year. Again, universal healthcare to a point in Canada. So drug coverage is not part of that that coverage that we all pay into through our taxes. And again, I'm not trying to knock our system, because it has been exceptional and wonderful to me. But when the time came that I needed to try a biologic, which was very expensive, there wasn't an easy way to just start that medication. I did have to apply for the funding for it through a provincial drug program here in Ontario, which eventually did cover most of the cost. There was a small deductible that I paid, but it was minuscule compared to the overall yearly cost of that medication. So eventually I was able to start that treatment. It didn't end up working that great for me anyway, and felt kind of bad that I went through the whole process. But when the time comes to get those more expensive medications, again, it can take a little bit of patience, a little bit of navigating bureaucracy and paperwork. And again, depending on where you are in the country, coverages can vary. and you might have more or less support around you in terms of people who understand the diseases. Having an IBD nurse, for example, will be a huge benefit to some people who live in the larger urban centers and are near hospitals or universities that have more of a focus on IBD care. But other parts of the country, there's still a lot to be desired, I would imagine.
Yeah. Jacinta, you want to talk a bit about what it's like in Australia?
Yeah, really similar to Rasheed as well, again, although we do have drug coverage. And so I was able to access biologics and have been able to do so at a nominal cost, which is, you just feel every time you pick up your script and it's got thousands of dollars written on it, but you've paid $6 for it, is incredible. And you, when I first was diagnosed, obviously unemployed, had no money, and being able to stay in hospital and be cared for in my humanity was something I really recognized at that time as such an incredibly important part of healthcare, of course, is that there's no barriers depending on how much money you have. But delay is something that we also face. So if you need to wait, then you have to, if it's not urgent. And that's sort of part of what you build into your expectations, I guess, with your hospital. But I also think access to care, I've thought about it a lot in terms of the way that patients interact with their healthcare providers. And I still feel like there is a lot of work that we can do in terms of how that power dynamic works in terms of advocating for yourself and having a more control in a system for getting what you need and having a voice in that. So I think that's kind of a little lateral, but I think it's a really important part of understanding the patient experience in terms of how we navigate such big institutions like hospitals and specialist departments.
Yeah. Self-advocacy, I think, is such a learned skill that often kind of just comes as you're sick over time. Most of us don't have the skills that we need when we first get sick to navigate our, especially here in the US, the health insurance companies will do everything they can to deny your care. And if you don't know that you can appeal their decisions and all of that kind of stuff here in the US, it often makes you feel, like you said, very small and often hopeless. And again, I think that's why our communities are so important, because people who've been sick for longer, they can, kind of guide newly diagnosed people in those very difficult bureaucratic situations. Okay.
Just add as well.
Yeah, go ahead.
I just really feel like I need to say, for people of color, our First Nations people, and people with complex disability as well, access to care, we can see through statistics, is very different. So I think that's a really important thing to acknowledge as well, is
Absolutely.
that healthcare is not healthcare. I think it depends on, there's a lot of biases within the system as well. Just wanted to make sure I said that.
I'm so glad that you said that. That's a big part of my book is how unequal care is for people of color in the United States, for transgender and gender fluid people in the United States, for anyone who has overlapping disabilities. I'm so glad that you brought that up. That is a very important point, because a lot of us do have many, many privileges that make navigating our healthcare systems easier. And when we have overlapping biases, care just is not as good. So I'm glad that you made that point. That's a very important thing to say. I want to switch gears a little bit here and talk to our doctor on the panel, Sara. Can you just tell us about maybe something that you're excited about in the research world of IBD?
Yeah, of course. There's a lot of interesting and exciting stuff, right? And this is what's great, is that we're really getting funding for IBD research to be able to better understand the disease and see how we can treat it better. I think some of the exciting things. So first of all, we're trying to find more cures, more medications to treat IBD. Some of them involve, infusions, injections, but some of them are pills. And so hopefully having a pill that can actually help, or having more options for pills that can actually help, can hopefully increase quality of life for our patients, so they don't have to keep coming to the hospital or need care at home. So that's one thing. The other thing that's exciting is there's a lot of work being done in terms of fibrosis and, narrowing in the bowels and trying to reverse that. We've so far thought that we're not able to reverse fibrosis or strictures, which are complications from Crohn's disease, which can lead to a lot of surgeries. But there are trials that are coming up. And so to see whether we could actually reverse that and hopefully decrease the risk of surgery and all this. And I think another super important aspect that we're seeing now is that it's really important to include the patient's perspective in our research trials. And it hadn't been the case up until this point, right? You look at remission, but then you also look at endoscopy and but how is the patient feeling in all this, and how is their quality of life? And so there's a push towards, patient-reported outcomes. What is the patient's perspective? How are the patients feeling? And just yesterday, we had a beautiful talk from Dr. Hart from the UK, who was just mentioning, a new classification system that's also based on how patients feel about perinatal Crohn's disease. And so I think this is really exciting because I think it's going to open up a lot of doors, just knowing how patients feel and following that as a guide.
To keep it on the positive side of things, I just want to go to Rasheed. Let's go to you in Canada. What's something like in the IBD community or anything that you've read right now that's kind of lifting your spirits or bringing you joy in the midst of your IBD?
Well, I think as Sarah had touched on, the research that is coming out and consistently evolving to give patients more options in terms of the treatments available to them is something that always provides me hope. And just actually seeing the number of doctors and researchers who are continuously working in the field is something that has always given me hope, because I had never heard about Crohn's or colitis until I started showing symptoms, and I went to the internet to find out all that there was to know at the time. And a lot of times when you think about someone getting into the medical profession or as a scientist, I don't know many people that start off training to be doctors or wanted to be in scientists thinking, I'm going to get into digestive diseases. There may be some that do it because of the fact that they have IBD themselves. In fact, I know some people who are going through their university courses now with the goal of becoming a doctor or becoming a researcher because they have IBD. But thinking back to the generation that are in the medical field right now, I'm not sure how many of those people would fit that description. So just having more people get into the field. I know that in Canada, our national organization, Crohn's and Colitis Canada, has a lot of initiatives to support young researchers, to support women researchers who are in inflammatory bowel disease specifically. So generating that wealth of knowledge and those people who will really take research and treatments to the next step, that gives me a lot of hope and something that I'm very grateful for.
I just wanted to
thanks, Sarah.
Yeah, thanks, Sarah. I just wanted to mention here that after going through several gastroenterologists when I first got sick and not really vibing, for lack of a better term, with any of them, the doctor that I've had for many, many years now, he became an IBD specialist because his wife, who's also a gastroenterologist, she got ulcerative colitis when they were in medical school. And so he really watched her navigate that, and he had been kind of leaning towards a different area of specialty, but then he kind of saw through her that they really needed specialists in that area. So yeah, you talking about that just made me remember my doctor and his very personal connection to IBD. Jacinta, do you want to tell us what's kind of bringing you hope and joy right now?
I think this sort of conversation brings me hope and joy that we are able to connect in all parts of the world and have such shared experience. I think is incredible. And like you, Tessa, I've written a book, as have so many people, and released them at a very similar time, because I think now is the time that chronic illness generally, and for Crohn's disease, we're kind of claiming a voice and finding a way that we can describe the experience to have it understood. I feel like for a very long time, you had to grin and bear it in the world. And there wasn't much understanding or support for illness in workplaces and families and all sorts of social environments. So I think now we've found language for it, and we've found each other and a confidence to speak out broadly in the community. I feel like we're going to see changes around the way that our policies and structures of society start thinking about illness, because there's so many of us that have chronic illness. It's time that it's accounted for. So I feel really hopeful that that's the kind of pathway that we're on. But also, yeah, getting together and seeing you all today is a wonderful positivity.
Absolutely. I agree. I think too, when you mentioned so many books and voices coming out, I think that a lot of industries like book publishing, for example, are really starting to realize that this is not, in fact, a niche market. And rates of chronic illness are going up, and especially after we all just lived through COVID, and people are having symptoms of long COVID, and there's this new generation of chronically ill people. I think that there are some shifting tides in the way that media companies and stuff think about the ways that they tell our stories, and who is the sort of market for those stories, and that it's not just a small sliver of people, that there are a lot of us.
And sorry, Tessa, if I could just latch onto that, it's not, in terms of the audience, it's not just people with chronic illness, it's people in general, right? I mean, like, health affects everybody in some way or another. And I think one of the challenges that we often find with people who, are healthy, quote unquote, is that they're just not sick yet. I mean, people will get some form of health battle or another if they live long enough. And I think when we look at sharing these kind of stories, it's important not to just seem as though it's for our community, although it's very important to our community, but everyone can relate to health in some form or another. And it is really great to see that more companies are willing to put those stories out there. And it's huge, especially on a day like today, where we're doing our best to raise awareness and, create the community within the people who have the disease and who are affected by the disease, but also to, educate those who don't, and make it a little bit more.
And also the experience of COVID has shown us that the vulnerability that we experience with chronic illness can happen anytime and anywhere. And all of the tenets, all the experiences of the COVID, where there was lockdowns and you couldn't see family and you weren't able to go out, is basically the mirror experience of what it's like to be diagnosed with an illness. So I think, as you say, Rasheed, this is not, an experience that only affects those that are unwell. It's so broad in how it speaks to our humanity and our experience much more broadly.
Yeah, I just, if people tell me that they don't know someone that's chronically ill, I tell them, yes, you do. You just don't realize that you know someone. So our stories, like you said, are not just for our community, but it really just has a ripple effect. Nordia, I want to make sure that I get to you. Can you tell us what is bringing you joy or hope right now?
I basically echo what Rasheed and Jacinta had to say regarding the research and the ability to now we can have open conversations regarding our illnesses. This is, for me, this is like, wow, because when I was first diagnosed, I really didn't want to speak about it at all. And this was based on the fact that I was just like, basically, what is this? What, and why have I got it? And who in my family has this sort of thing? And as Rasheed said, when he was going through symptoms, obviously he was going on the internet and trying to find out. I did just basically the same thing. And obviously you never Google your symptoms at all, like, because I was
That's the golden rule.
I was diagnosed with all sorts. So, you know, the ability to now that we having the research and also the conversation, and also that, you know, it's not getting downplayed anymore. It's, you know, this is something that, you know, it's causes a lot of suffering, you know, physically and mentally. So, you know, just sitting here right now is amazing for me, because I wasn't doing this kind of conversation 2 years ago. I didn't want to know about it, basically. And the fact is that, you know, my last operation that I had, which was about 6 weeks ago, I looked at my ileostomy and I looked at the bag and I was just like, surely there has to be another color or something. I was able to go on Instagram and there was, like, I saw the black version. I was like, oh my God, they have it in black. So yeah, and you know, just by doing that, I was able to say to my nurse, oh yeah, can I have some of those black bags, please? Like, so this, you know, this is amazing, like, for me personally.
Yeah. That makes me so happy to hear all of those things. You're all bringing me hope and joy today, that is for sure. Let's see, I want to ask, although we're all in very different parts of the world, we are interconnected, as you can see on this Zoom call right here. What is something that you think is sort of universal across the IBD community, no matter where you're located? Jacinta, do you want to maybe go first?
Yeah, I guess the first thing I think about is just, like, it is so beautiful to hear Nordia and Rasheed describe, because it feels like, yeah, everything you say. I think we're humans, and I know that's a ridiculous answer, but regardless of the systems and the health systems and the way that we maybe have an awareness around the illness, I think the fact that illness affects us and our identity and asks us to question ourselves in ways that perhaps we hadn't before is such a uniting experience, because we do it in very different ways, but we do it. And I think I've always found that just such a uniting feeling, to know that that very deep part of illness is shared, that secret part almost. There is a real connection when you hear that from other people.
Absolutely. Rasheed, how about you?
Oh, you know, again, I think it's just it's what we're doing right now. This kind of a conversation that we're able to have with one another. You know, before we actually went live today, like Nordia was mentioning how she hadn't, you know, been too vocal about like sharing this kind of stuff with an awful lot of people. And I said, well, this is the group to start with, and you know, and hopefully you know you're feeling the same way about that as we were 48 minutes into this now. But you know, in all the interactions I've had with other people who have IBD, there is an immediate understanding of one another when you meet people right away, and having that empathy, I think, is the biggest connecting force, I think, between people who have IBD or care about someone who does. And that I volunteer with our local chapter of Crohn's and Colitis Canada, and back when we had in-person meetings, when it was, you know, safe and legal to do so, which now seems like forever ago, we'd always get, you know, new people coming in every once in a while who just wanted to unload. You know, they hadn't really had a chance to talk to other people, even their closest family and friends. They can tell them their experiences, and it may just be a shock. They can tell them their experiences, and they may not get an awful lot of empathy. They'll certainly get sympathy, but actually talking to other people who know what it's like, it leads you to open up in a new, opener kind of way, if that makes sense, where you're sharing more and things just come easily. And those conversations that I've had at the chapter level with the other volunteers that I've worked with over the years, that connection has been, you know, long lasting and very special, and something I'm also very grateful for.
Yeah, absolutely. I've talked and written about this before, but for a couple of years, early in my diagnosis, I didn't really seek out support groups or mental health support or anything like that. I think, like a lot of you have shared here, it was just like I was searching for, a fix for what had happened, and I was still in a lot of very heavy grieving for the first couple of years. And then when I did join some online support groups first, just to kind of dip my toe in the water, I just sort of lurked there for a while before participating. But even that, it was such a life changer for me, because what I had been burying for those few years was just so much shame, right? And to be in a space where that shame was lifted among people who really deeply knew what it was like to go through chronic illness and all the emergencies and hospitalizations and the mental health part, and your relationships changing and your careers changing and all of these things that, like you said, I think a lot of able-bodied, non-disabled people can relate to, maybe with sympathy, but to connect with these people with really true empathy and shared experiences was just so life-changing for me. And then when I was brave enough to participate in those groups and to really just have nothing shown to me but acceptance and love and understanding, that was just so important for me. So that's something that I always tell newly diagnosed people, is like, just lurk on some support groups for a while, even if you don't feel comfortable enough yet to, participate. And like you said, people do want to unload, because it's a heavy, heavy burden. And sometimes they don't know who is safe to share that with. So I feel like as our community grows and it creates this, safe space for people to share, that's just so important. Nordia, did I get to you? I can't keep track.
No.
Do you want to share?
It's just being able to relate to, like, and I mean truly relate to, in like, you'll say something and they'll say, oh yeah, I've been through that, yeah, I know exactly what you're talking about. And it's that safe space, as you mentioned, that you can truly share your experience and stuff like that. Obviously, as I said, I keep on going back to when I was first diagnosed. It's just such a complete different contrast to what it is now for me, my personal experience, because I didn't want to talk about it. I didn't feel comfortable enough talking about it at all. So for me now to be sitting here having these type of conversations, I just find it amazing. And it's like there's a burden that's finally been lifted. Like, I was far more comfortable talking about my other genetic condition, and had an audience and stuff like that. And then I thought to myself, no one would want to listen about my IBD. Like, who wants to listen about ulcerative colitis? But now I find, like, I literally post, I make posts on my Instagram, and this is why I've ended up in this conversation. So, like, there's people out there that are going through the same thing that I'm going through, and they always will be able to lend an ear or some advice or the comforting of a shoulder or something like that,
Yeah.
So yeah,
I think you touched on something that's so important, which is that, like, there's the burden of shame with any chronic illness, but then when it's a bowel disease that also has this stigma of, like, something you don't talk about in polite company or whatever, it's this other layer of shame. So it's like, just this onion. And I think that the internet and social media really has, for all of the evils of the internet, I think for people with IBD, that it has really kind of shifted the ways that we feel comfortable talking about what our disease actually does to our bodies. And with that sort of shift, a lot of that stigma has lifted. And like you said, even a few years ago, you wouldn't have been having this conversation. And I think that means that we're making some progress. So that makes me happy to hear.
And so
Oh, go ahead.
And I just remember the first time when they, you know, they said to me, I need to have my large intestine removed, obviously. And the first thing I said was, well, how would I survive? How, am I gonna die? Like,
Don't I need that to live? Like, come on, guys.
Yeah.
How are you gonna do that? So even that sort, like, and when I say that to people now, like they people that don't understand about the IBD, they will ask the same thing, like, how are you here?
How are you alive? Yeah, I definitely have had some similar moments like that. We're coming up on an hour, so I want to get in a last question for everybody. And I think the thing that I want to wrap up with for everyone is just what's the one thing that you would like to see change or progress when it comes to IBD where you are, and that can be either like community or cultural stigmas, that can be barriers to care, that could be something that we haven't even touched on yet tonight. So let's go over to Sara first in Abu Dhabi with sort of a physician's perspective. What is something that you would like to see progress in the world of IBD?
Thanks, Tessa. It's just so nice to hear about all of your experiences and you know, to see how much it really helped you to be able to share and talk to people about this. One big issue we have in the region is, like I was mentioning, access to good care, access to reliable information, access to the support online, because of language barriers, because of the social stigma that there is, right? So people are under pressure. It's very difficult for them to live with their disease. They get social pressure, family pressure, pressure from friends, and even, you know, physicians and providers sometimes who don't know about IBD. So I think the number one step would be to just improve awareness of IBD. You know, get patients, but doctors, everybody to know about IBD better, so that we're able to tackle it better.
Yeah, well, you're doing that now, and we're so grateful. Nordia, do you want to answer that question?
Off the top of my head, I think it'd be the stigma. It's to try and sort of like remove the stigma around IBD, and just have, so that we can have more open conversations and people can, you know, conversate openly without feeling ashamed or feeling embarrassed or anything like that. You know, I think there's a lot of people that are still suffering, and they want to talk about it, but they just don't have that safe space to talk about it, or they feel like they, you know, who wants to hear about my bowel situation? Nobody does, sort of thing. Right. So I think, you know, if we were able to take that away, we'd have more open conversations and more people coming forward and sharing their life experiences and stuff like that, you know, because who really wants to live their life in shame and stuff? And, you know, being ashamed, also you feel ashamed of your body, because it leaves the scars, it leaves, you know, the bruises and stuff like that, and you feel like, but you're thinking, well, my body doesn't look great, because I've gone through a stage where I think, oh my god, my body looks awful, and so I didn't want to show it. I didn't, you know, and because I've got an ileostomy, I also think, oh, everyone's going to see it, even though when I look in the mirror, I can see that, you know, I can't see, but in my head I think, oh, everyone knows that I've got this, sort of thing. But, you know, and so what? So what? This, you know, it saved my life. So, and I should be proud of it. Like Sally, you saved my life. So
yes, Sally.
Honestly,
it's so true. Yeah,
it's that stigma. It's, you know, trying to remove that, to take that away, to, you know, because even now having this conversation with you guys, I'm open to talk about it, but I'm not that open in a sense where I'm just going to go out there and, you know, start showing my ileostomy. And, you know, it's something it saves me, as I say, you know.
Yeah, I think it's just, you know, progress sometimes happens slowly, and, you're gonna get more and more comfortable talking about it. I mean, like you said, even conversations that you have now and shifts in your thinking over just the last couple of years. You know, I write very publicly about my illness, but it took me many, many years to get comfortable enough to do that. So I think some people will read my writing and be like, oh my God, how are you so comfortable talking about this? And it's like, well, it didn't happen overnight. You know, it happened in these small groups of, like we said, safe people where I could, you know, talk about this stuff. And then over time it became easier and easier, but you know, it did lift a lot of shame that I had about my illness, and like you said, you know, my body and the ways that it behaved because of IBD and the ways that it looked because of medications or whatever. And you know, I think even slow progress is still progress. So, you know, you can pat yourself on the back for that, for sure. All right, who haven't we heard from? Rasheed?
Sure, and just in the interest of time, I think I'll try to leave it at two main things that I would like to see. First of all, in terms of awareness raising, I'd like to be able to step outside my door, ask 10 people, do you know what IBD is? And all 10 of them say, yes, I know exactly what it is. Just having that kind of awareness go across the board would be wonderful. And specifically here to Canada, basically, we would like an NHS. Something that provides that kind of care very quickly and easily, I think would be very beneficial, especially when it comes to pharma care. And I would think also something that kind of gets forgotten is ostomy supplies and the cost of that. If there's some kind of coverage for that, I think that would be beneficial for patients. When we talk about pharma care, especially, as Jacinta had noted in some of her earlier comments, you're sick at a time where you often can't work. And if you're being asked to pay for medication when you can't work because you need the medication in order to work, it's a strange, you know, it's a cycle that can prevent you from getting healthy again. So having that really solid pharma care, expensive as I know it will be, I think it's something that would be beneficial for not just IBD patients, but people across the country who need supports for their health.
Absolutely. How about you, Jacinta?
Just really quickly, I just so resonate so much, Nordia and Tessa, about the shame thing. And I think that whilst we are trying to get rid of that stigma around this, I hope not to reduce us to also IBD. It's so nuanced, it's so specific, it's so like profound, Nordia, hearing you describe your experience. It's so, there's so much complexity to it. I hope that we can put that into the conversation as well, that our experiences are unique while we're shared, and it's more than, you know, there is so much to the experience of illness beyond symptoms. It's how we interface in the world that often makes that a really hard thing. So I think that's something I'd love to see. I think a little while to go before we do that, but that's where I want to move.
Yeah, but I think conversations like this help us work out those nuances, and yeah, I'm glad to hear you say that. I'm gonna bring Rebecca back in to give a couple closing remarks, but I just want to thank you guys so much for participating in this today. It's really special to be able to connect, as much as we're all sick of being on Zoom all the time. This one was an exception. And thank you guys for staying up late and getting up early and joining from all over the world. I hope that some of the stuff that we talked about here today will help someone who's tuning in, and help them to know that they have a very wide global community of pretty special people. So thanks everybody so much. And Rebecca, I'll turn it back over to you.
Thank you, Tessa, for moderating such an informative and meaningful conversation today. I really enjoyed listening to all of your perspectives and learning so much from how each of you are experiencing things, both differently and similarly in different countries around the world. Rasheed, Dr. El Ouali, Jacinta, Nordia, thank you so much for joining us and sharing your perspectives. We really appreciate you taking the time out of your day or the future or the middle of the night, depending on where you're located, to chat with us. Just a couple quick last minute things. It's in the US and Canada, parts of Canada. It's not too late to still get involved for World IBD Day. You can create a personal infographic, purchase one of our multilingual shirts, which I tried to wear so you can see, but it's kind of hard to see, or more by visiting our website at www.crohnscolitisfoundation.org/World IBD Day. And if you have questions about IBD in general, you can always contact our IBD Help Center at info@crohnscolitisfoundation.org. Thank you, everybody, and have a great rest of your day, evening, next day, whatever it is.